My name's Ian Beckley. I'm a consultant urological surgeon. I chose urology because I had some really inspirational teachers at medical school. I found the topic really interesting, really exciting, and it was the ability to very quickly and easily relieve patients' symptoms. If somebody's in pain because they can't empty their bladder, you pass a catheter, they're instantly your best friend for life. So it's very rewarding, very satisfying specialty. My reasons for becoming a doctor, I think from a very early age, I mean, it's the only job I can ever remember wanting to do. And I just had a sort of lifelong fascination with how the body works and wanting to help and heal people. It's cliche, but that's really sort of what it comes down to. It's a fantastic career, and it gives you the opportunity to interact with people in ways that you just don't get to do in other jobs. You go on a journey together with your patients, and hopefully you come to the other side, and they can move forward with their lives in a much better way than when they came to you. So again, it's very extremely satisfying, and it's just it doesn't really feel like a job because it's such an enjoyable thing to spend your time doing. What I find most rewarding is the fact that as a consultant, you're with patients for quite a long time. You get to really go in depth in terms of, managing their symptoms and getting to know them and going on that journey with them from often. Because I have a very specialist practice, patients will have seen, many doctors before they come to me. They'll often feel like they've been passed from pillar to post and won't be happy with, with where they are. And so I have a really good opportunity to kind of start from scratch to go in depth into their symptoms and their history, and to work with them, try and formulate what the diagnosis is, and then explain how we're going to proceed and hopefully get them going in the right direction. So I find it really satisfying, and it's a my practice of urology, it's not always straightforward as a lump or a bump on a screen. Often you have to work out exactly what's going on, put the pieces together from a detailed patient history and examination, and then work out what's going on, and then try and improve things for the patient. I think they like the fact that I'm very down to earth, and I have a fairly laid back approach to taking a history, to getting to know them, to interacting with them. I try and use humour to put them at ease when it's appropriate, and I make sure that I give them plenty of time to ask whatever question they want. I use the drawings. I'm certainly not the best artist in the world, but I try and incorporate drawings into my consultations to make sure the patient understands exactly what's going on and what I think we need to do to try and improve things for them. So I think they find me approachable. I think they find me not quite what they're normally expecting when they think they're going to see a consultant, but just somebody who'll talk to them on a sort of human level and will help them navigate, the complexities of medical pathways. I think a lot of the patients that I see, as I said, they'll have had lots of other doctors involved in their care, and they are often very resilient people. They've come through difficult circumstances, and it's just nice to be able to go on that patient journey with them, and to see them, from when they come in burdened with bothersome symptoms having a massive impact on their quality of life, to be able to work with them to get them better, and to see them go off and enjoy their lives again. I just find it extremely rewarding. There's a saying that I was taught at medical school. It's listen to your patient and they'll tell you what's wrong with them. And I think as doctors, you can often have preconceived ideas about the diagnosis and what's the cause of the patient's problems. But if you take the time to really listen to them, often the diagnosis becomes obvious because they've explained it to you, and you can work out what's going on.